as we work through. Okay, we need to consenting to be recorded. Yes. And then I should be able to ask if I want to record it to the cloud, which is a yes.
I took care of that, Judy. We're recording now.
Okay.
Oh, okay. Boy, it's so great to have a collaborative team to handle all this stuff. Thank you, Rachel. Okay, let's begin. Welcome to today's program. Yes, I'm looking at a script. If I look aside every once in a while, this is only the second time I've hosted these monthly meetings. So, you know, I don't want to miss anything. I'm Judy Alden, president of the District of Columbia chapter of the Hearing Loss Association of America. On behalf of our chapter and everyone on the board, welcome everyone. I hope we're all enjoying this pleasant autumn season. Thank you for being with us today. I'm glad you will join us to learn more about HLAA's national initiatives presented by Lisa Hamlin, who is Director of Public Policy. A few logistical things. We already had quite a few logistical things, but a couple more logistical things before we get into the program. We continue to meet virtually on Zoom for the foreseeable future, like many other organizations. We usually meet in DC public libraries and look forward to doing that again when we can actually see and hug one another. But until then, we're Zooming. And I'm pleased to say our chapter seamlessly moved from live meetings on a monthly basis to Zooms. Let me quickly review Zoom how-tos. I think by now we're probably all zoomed out and know all these things, but as today evident, sometimes there's a button to click that we may not know about. If everyone could please mute at the bottom of your screen, there's a row of icons. If you could please click the slash, that will mute you so we don't hear people's dogs and autumn leaves rustling in the background. And when you're recognized for a question, simply unmute and then we can all hear you. Captions. Our monthly programs provide CART, real-time captions. Thank you, Natalie, for another person. Thank you, Natalie, very much for getting us queued up this morning and the wonderful job you do providing those captions. If you want to see captions, click on the icon at the bottom that says CC. And that will enable you to open up the captions. If you want to move your captions on the screen, the same way you do the chat box, click on that box and you can move it around the screen so they're not overlaying one another. Questions or comments? I would encourage you, as Lisa goes through her presentations, to capture your questions and comments in the chat box. And then Lisa, at an appropriate time, can address questions, or certainly at the end, make sure we've addressed people's questions. I think that readies us all to use Zoom. Anyone, I'm assuming no one has any pressing questions about how to best use today's time together. A quick note about HLAA membership. How do we come to be here today? How do we come to have the great work Lisa's doing on a national basis? How do we come to have these programs available to us? It's through the benefit of members. Did I hear a comment? Through the benefit of members and donations, and certainly volunteer time. If you haven't already joined HLAA, I encourage you to do so. I will put this in chat box. It's a pretty easy one step. You go to hlhearingloss.org and membership, and that will enable you to join both national as well as the DC chapter. We very much appreciate your participation. As a member, you'll get lots of benefits, including our informative magazine, Hearing Life, support about developments in hearing assisted alerting technology, hearing speech, hearing loss research, useful communication strategies, an endless litany for those who've been on these calls before of benefits to members. For those who are new, please check out that website and get a feel for all the benefits available to you as members. An example of your support at the local level, and this is kind of a heads up, after 3 years of advocacy, finally, the District of Columbia will have an office of deaf, blind, and hard of hearing. It's budgeted to open October 1st, a couple days ago, and funded. In a week or two, let's say 2 weeks, knowing how things move, in 2 weeks, I've been promised we will have a job description for the executive director. We will share that with you all, and please share that with any and all you know who would be effective leaders on behalf of the hard of hearing community to run this very important new office. Quick overview of next programs. On October 31st, Dr. Samira Anderson of the University of Maryland will speak about untreated hearing loss and its relation to cognitive decline. If you're on our mailing list, you'll get an invitation, and you need to RSVP so we can add you to the Zoom list. If you're not on our mailing list and want to be, please contact the HLAA-DC chapter. Again, I'll put that address in the chat box, and we're happy to add you to our list so you don't miss any of these opportunities. Also, this season, normally we have a holiday party at a restaurant, which is great fun. Again, in the I was going to say spirit of COVID, but that's kind of an oxymoron. This year, we're going to have a virtual holiday party. So there's more information to follow on that as well. Then now a special announcement about the Walk for Hearing, which is coming up in a week or two by Rachel Stevens. Rachel is our chapter lead for the Walk for Hearing and also chapter vice president. Rachel, it's yours.
Hi, everybody. Thank you, Judy, for giving me a minute to talk about the walk. The walk will take place on Saturday, October 16th, which is coming up. And I'm putting a link in the chat for how you can sign up for our chapter team, HLAA-DC. I'm going to take just a minute to share my screen and show you what that looks like. Can everybody see my screen? So this is where the link will take you. And there's a green button in the top right-hand corner that says Join Team. When you click that button, it will ask you to register. It might ask you to log in. I'm already registered, so this is what I see. And then there's also a way to make a donation on this page, and I'll put this link in the chat as well. You can go to this page and make a donation to our chapter as well. So the walk will take place at National Harbor. Check-in is at 9 a.m. and the walk begins at 10 a.m. And we're really excited because it's the first time since 2019 that the walk will be in person. So we're looking forward to it. Should be a lot of great energy. And we really hope that everyone can join us. So if you have any questions, you can send me a message in the chat. You can reach out to us through email, and we're happy to help you out, but we hope that we will see you all there. Thank you.
Thank you, Rachel, very much. I've attended since 2016 when I got involved in HLAA, all of these Walk for Hearings, except even the last couple that unfortunately had to be virtual. It's a wonderful, fun experience to meet people, have a great time, families, friends. I encourage you all to really open your arms to inviting participants. And if they're not able to walk, it's an opportunity to make a worthwhile donation. I think that wraps up the introductory information. Ross, I'll turn it over to you. If you could please do the honors to introduce our guest speaker.
Thank you, Judy. Hi, everyone. I'm Russ, and it's my pleasure to introduce Lisa Hamlin. Many of you already know her, but for those who don't, Lisa is HLAA's Director of Public Policy, working out of the association's national headquarters in nearby Rockville, Maryland. Her responsibilities include representing HLAA on federal advisory committees, industry advisory groups, and consumer coalitions, including the Federal Communication Commission's Disability Advisory Committee, the Transportation Security Administration's Disability and Medical Condition Coalition, AT&T's Advisory Panel on Access and Aging, the Deaf and Hard of Hearing Alliance, and the Deaf and Hard of Hearing Consumer Advocacy Network. She has also taken part in developing, maintaining, and presenting training programs on hearing assistive technology and on emergency preparedness. Prior to joining HLAA, Lisa worked with the League for the Hard of Hearing in New York City and the Northern Virginia Resource Center for Deaf and Hard of Hearing Persons in Fairfax, Virginia. So all told, she has worked as an advocate for people with hearing loss for more than 25 years. And without any further ado from me, welcome, Lisa. It's all yours.
Thank you, Russ. And thank you all for inviting me here today on this lovely Sunday afternoon here. I appreciate being here. I want to say first, before I get started, that we talked about answering questions. So it would be best if we did it at the end. I usually like people interrupting me, but there's no way to get through all the slides unless we do it at the end. So you can put questions in the chat, but if I miss them, please feel free to speak up at the end and ask questions. And if you can use the little hand raising tool, that would make it a little bit easier because that brings you right up to the front screen. The other thing, and I'll put this on the co-hosts here, sometimes I lose track of time. Please tell me when it's time to go. I'm happy to stay as long as there are questions, but I don't want to keep everybody out inside all day here, okay? So I'm going to share my screen now. Okay, can everybody see that?
Mhm.
All right. And I'm moving things around because I couldn't see you before. So I will try to keep track of the people who are on screen. I know some people have turned off their camera, which is fine. Either way you want to do it works for me. So today, I was actually preparing an advocacy update for another chapter. And I realized I looked at last year's advocacy update for you guys, and I really got into the weeds that nobody really except DC people really understands some of the things that we talk about when we talk about legislation, when we talk about regulation. People in DC really get it because a lot of you guys have worked for the feds. But when I talk to people in other parts of the country, they don't. So I don't want to get too far into the weeds so that we have enough time to cover the topics. But if you have questions about some of the details, I will have some answers and some, because some of it relates to legislation, I do not know yet, but I will let you know what I do know, okay? Okay, hold on a second as I try to forward this. There we go. First up, I wanted to let everybody know that you'll be seeing in the e-news, if you get your e-news from HLAA, you'll see that TSA, Transportation Security Administration, has honored the Hearing Loss Association of America with an award. Oh, shoot. With an award that comes from our participation in the Disability and Cultural Coalition Conference. And I wanted to give a shout out to Lon Rosenman, who has been hugely helpful in the past few years. There are times when I cannot attend or when it's best because he has interest and involvement and he's gone to these meetings. So I want to be a big thank you to Lon. So that's first up and you'll see that coming and the news will be coming out soon. But let me go back here to what I'll be covering today. I'm going to be talking about recent federal legislation. So I'm not going back in history, but we're talking about what's going on now. A little bit of history with OTC, over-the-counter hearing aids. And then most of the work I do, as you probably know if you've been here before, and my advocacy updates, is a lot of the work I do is regulatory. So I'll work with the FDA, the FCC, TSA, Department of Transportation, Department of Justice, whoever needs something and we can get involved in, we do it. Today, I'll talk about our work with the FDA and the FCC. And then we'll talk a little bit about what's going on with the pandemic and how it's impacting people with hearing loss. I also like to talk about our mission statement. So I bring that up front whenever I talk. So the mission of Hearing Loss Association of America is to open the world of communication to people with hearing loss by providing information, education, support, and advocacy. See, I wanted to say advocacy first because that's what's always on my mind. But it's the last on the list here, but not the least in important. So we do advocate for communication access wherever it's needed and wherever a law can provide for it. But even in situations where we just negotiate, sometimes there is no law to cover it, but that doesn't mean we still can't advocate for communication access. Let me talk first a little bit about legislation. The big one is Medicare. Now, when I came here almost 14 years ago now, when I came on staff, I had been working with Hearing Loss Association of America for a long time. And for those who don't know me, I wear a cochlear implant and I wear a hearing aid. So I have a significant loss. In fact, when I was just experimenting recently and taking both off, I'm pretty much deaf without it. So that's why I am hugely dependent on captions. And some voices I can hear pretty clearly and some I cannot, and I'm listening over a computer. So that's why I'll miss you. And when we do go to Q&A, if you speak, understand that I'll need to read the captions, so I'll be behind by a beat. So when I came on board in 2008, the first thing I wanted to do is to get Medicare coverage for hearing aids because a lot of our members and supporters are Medicare age. And it's the #1 call and email we get in to the office. People who are on Medicare, some of whom are on a fixed income, who have no other means of support, look at the cost of hearing aids and say, I can't afford it. What do I do? And there are really very few good options. We can point to less expensive avenues. We can talk about Costco, which has a very good reputation and has name brand hearing aids and charges less than an audiologist. And part of the reason for that is Costco can bring them in bulk. They are in fact either the #1 or 2. I haven't recently heard statistics, but I was hearing the #1 buyer of hearing aids is the Veterans Administration. Has been for a long time, but I've been hearing that Costco is now buying more than that. So when you buy it in that quantity, you can bring down the costs. So that's a place, but they don't just sell them and have nothing to do with it. They have very good reputation and service. They're easy to buy. Their return is like 90 days, longer, 6 months, I'm sorry. So nobody else has 90 days. So you can get a hearing aid, try it out and do well with it. So we point to that, but if you really you can't even afford that there and you wanted to you were on Medicare, you really had few choices. Medicare Advantage does, some Medicare Advantage plans do cover hearing aids, but I have heard mixed reports on Medicare Advantage. It depends on what you need. You have to be very careful and make sure you read the fine print when you get an Advantage plan. So we wanted to see Medicare cover it just upfront, traditional Medicare. And I was told in 2008, I said, the audiologist, I talked to them, can't you get on board with us? They said, oh no, the audiologist will never support Medicare coverage because it would put a cap, limit to how much we could charge for hearing aids. So we're not going to skip behind that. Okay, then roll forward and life has changed. The over-the-counter hearing aid law has passed and times have changed altogether. The market has been shaken up. Audiologists now are in favor But what they would like to see, and we support, is that Medicare will probably cap, if this passes, Medicare will cap what they will pay for in a hearing aid. Language we'd like to see is if an individual would want to purchase, say they were offering only a basic aid, and an individual says, no, I want a premium aid, they would pay for the cost of the basic aid, and then the consumer themselves could cover the rest of the cost for that premium aid. We don't yet know what language is happening, what will be the final language. I suspect that there will be some movement right up to the last minute, and we don't know when the last minute will be, because this is not a standalone bill. There are several. Let me forward. Let me first, before I forward, I got ahead of myself. Let me just say what we support is coverage, Medicare coverage for people with. Actually, we would love to see Medicare cover everybody, but the score, which is the cost of the bill for everyone, would be so high that it would eliminate the possibility of including it. So we have agreed to the idea of limiting. So the mild and moderate hearing loss hopefully will be covered by over-the-counter aid. So people will have access to a less expensive aid. Moderately severe people and severe to profound, and profound are another group of people. So if you have a profound loss, you may well want to go toward a cochlear implant. But that moderately severe hearing loss is something we'd like to see included in the legislation. What we have been hearing is that may not happen. It may only be severe, profound that are covered. Again, trying to cut the costs, Congress has to be careful about how much they spend on any one thing. Although I have to say that we've been hearing that the dental costs are far higher than the hearing aid costs. So we'll see. We don't know what will happen, but that's what we're doing. That's what we are proposing. We also propose that not only audiologists, but hearing instrument specialists or hearing aid specialists, they're sometimes called, are allowed to provide services under Medicare. Now, hearing instrument specialists are not recognized at all under Medicare at this time. Audiologists are. At this point, you can, even with Medicare now, if a doctor says, I want to diagnose what this person's issue is, they can go to refer them to an audiologist to have a test. They can't get a hearing aid, but they can refer to the audiologist, and the audiologist can be reimbursed under Medicare, not the hearing instrument specialist. So we'd like to see that expanded, because we know that most audiologists live in cities. They have a lot more education to pay for, and they tend to gravitate toward places where they can get paid higher rates. Out in the countryside, out in rural areas, you tend to see more instrument specialists. And so we want to see everybody, as many people as possible, get covered. So that's our stand. Now, these bills, and I just checked yesterday, so these are the bills that have been introduced that cover that different language, have slightly different perspectives on it, but they would all cover Medicare coverage for hearing aids. We don't know which of these bills or what combination of bills, or if it'll be a different bill, because it could be last session of Congress, and HR 3 was passed. That was the bill that was looking to reduce costs for drugs, but we got hearing aids attached to that that would be covered under Medicare. And that was the McBath bill, which was very similar to Representative Debbie Dingell's bill, but Representative McBath's name was on it. And then it got attached and it passed the House, but it never went anywhere in the Senate in the last Congress. So one of these could be picked up or could be totally different. They're not telling us. We don't know. But what we do know is we've been meeting with members of Congress, sending our message. So either Barbara Kelly or I have been going in, talking to staff members and telling them what we think, how we think the legislation should be written. And that, in fact, bottom line, we want to see Medicare coverage, hearing aids, and services. If it succeeds at this point, the talk is that it will be attached to the budget reconciliation legislation, which is why we don't have real details yet. But what we are telling our members and our supporters is to write to Congress and say you support coverage of hearing aids under Medicare. Just that. You don't have to tell them all the details. You can tell them your own story. You can have your own opinion. You can support our position that it should cover moderate severe, or you could just say, please do it. We have put this action alert out, and here's what our action alert looks like. It's still on the website, and you can get it at that URL at the bottom. People have gotten back to me and said that their legislators have gotten back to them. They understand that this is being considered under the reconciliation bill, so you don't even have to mention that. Just mention what it is you think is important about this bill. And because things are moving slowly right now, slower than we thought, there's still time to write. So go ahead and write if you haven't already. So over-the-counter hearing aids, that legislation passed in 2017. We expected the process for the notice of proposed rulemaking to get underway in August of 2020, and nothing happened. We don't know what the hangup was. We don't know why it didn't move. But President Biden sent out an executive order that had a whole long list of things that he wanted to see happen. And one of the things that was included, we were really thrilled by this, is that to tell the FDA that it was time to get moving on getting the notice of rulemaking out. We have spoken right now, it's in the Office of Budget and Management. We have spoken to them, told them that it's important for them to move forward with this legislation. And one of the reasons it's good because we know even after the rulemaking starts, it's going to take a while before we get the rules in place, before before the manufacturers have a real understanding of what is allowable under the new law. But not only that, in the meantime, there's this huge confusion going on. So I had my intern take a look at what's going on the internet, and she didn't look for every single thing, but she found over 50 websites selling online products, everything from a $20 hearing aid, they called it a hearing aid, sold at Walmart. Everything from that to several $1,000s, what they were calling a self-fitting aid. And Bose has a self-fitting hearing aid. It's not over the counter and it's not a traditional hearing aid. It's what they call the de novo product, which they've gotten approved by the FDA. And so it's a legitimate product that's being sold on the internet. But not everybody's like that. Some of them are just sound amplifiers. Some of them are a little sketchy. Some of them are fine. And the problem is we have a lot out there and very little way for the consumer to make comparisons. So we're urging the FDA to move as quickly as possible to help reduce that confusion among consumers. So we have up on our website also, we have a new page, but we also, this has been up on our website for quite some time, since the time that the law came out. We put together what information we thought the FDA should see. And of course, we want the devices to be safe and effective. That's always something that's important, but it's not just that. That's something that the FDA, that's what they're regulated to do. That's what their job is, to make sure that they're safe and effective. Affordable is a different issue, but that's what we'd like to see. We'd like to see them affordable too. We want to see them properly and adequately labeled and described. And by that, we mean that this is a consumer, labeling is a consumer piece. It's a way to inform the consumers about what they can get. So we want, obviously don't want a whole, 20-page treatise on the back of a product, but we want enough information. The person who has never bought one of these devices before knows what to do. But importantly, we have asked the FDA to look at recourse. What happens if the product fails? What happens? Where do they go to complain? Because when you have a product you purchase from your audiologist or hearing instrument specialist, you go back to them. You say, this is a lemon, help me. And there is recourse if that person does not help you. Here over the internet, it's a little bit more amorphous. So we want to see the FDA step up and let people know what it is they need to know. And we think on top of that they should provide or find a way to provide consumer education, because we think, again, there's going to be, even before all these websites started coming up and people started shooting out information about over-the-counter products, even before the product exists by the FDA, we knew that this was going to happen, that there was going to be a lot of people out there and a lot of confusion. And we felt that the FDA, it was incumbent on the FDA to provide the real solid information they need. We will do our part too, but we think that it's important for the FDA to recognize it's an issue. So the other thing that we say on our website and have told the FDA is we need to make sure that people know it's for adults. We don't want parents purchasing over-the-counter products. So those children really need to go to an audiologist. That would be best, or even an instrument specialist to be properly fitted. We also want to understand that it's for people with mild to moderate hearing loss. So somebody with a complex hearing loss, or asymmetrical hearing loss, or a severe hearing loss should not be looking to over-the-counter products to help them out. A way to provide consumers to report adverse events, contraindications. We just got, and I always thought, when we were having these discussions, audiologists were saying, oh, no, you don't want to buy over the counter. What if you have, something dripping out of your ear? You don't want to have somebody buy an over the counter aid. And I said, oh, no, who's going to do that? If I'm dripping, I'm going to go to my doctor. Even if I don't have an ENT or an audiologist, I would go to my primary care doctor if my ear is leaking. I have to say, we just got a call through, it was an email, somebody saying, I'm dripping out of the ear and my doctor wants me to get a CT scan. What should I do? Like, go listen to your doctor. You don't like one doctor, get a second opinion, but don't talk to me. Go do something if your ear is something coming out of your ear. It seems counterintuitive to me that somebody would do anything else. But so I guess it does happen. But I think that's rarely. This is the first time in my 25 years of working in the field that I've ever heard of that. So we want to make sure people know what the return policy is. And we're asking for this. And this is a reach, but we'd like to see it happen. We'd love to have information on the box that says whether or not there is a telecoil, whether or not the device has been tested for hearing aid compatibility with phones. It probably won't happen. There are no rules now that say hearing aids must say that. But why not ask? We'll see if that happens, and we'll see how consumers respond to it. So we have a brand new page out, which puts a lot of this information together, talks about Medicare, talks about OTC, and talks about how some information on hearing aids in general. So it's Medicare, OTC, hearing aids, and you. That's a link to it, but of course you can't get it on the link. But if you go to our homepage, which is hearingloss.org, it's one of the first, you'll see a cartoon that was produced by Johns Hopkins. Dr. Franklin has been very involved with this because he was one of the first people who recognized, and his research was among the first, if not the first, to show that there's a linkage between dementia and hearing loss. So he has been a huge advocate for somebody doing something about their hearing loss to make sure that there's as little stress on their brains as possible, because that's how he theorizes is happening, that the dementia is because just listening causes such a load on the brain that it's harder, that the brain shrinks and makes it harder to go forward and may be more susceptible to dementia. I mean, we don't know, this is all theory, but it's certainly it's something to think about. And if you can get a hearing aid and treat it, why not? Even if you don't know for sure, it makes sense. So he's been a big proponent. He has a cartoon that makes it very visual. And we have that on our website and a link to his website as well. Or the Johns Hopkins website, I suppose, not Dr. Lynn's website. Okay, so now let me talk a little bit about regulations. So one of the things we work with a lot and have for many years now is talking about hearing aid compatible cell phones. Now, years ago, there was a huge problem. This is many years ago now. We're talking 15 years ago, 20. When you got a cell phone and you held it to ear, there was such noise on the line because it was not compatible with your hearing aid that you couldn't basically hear what solutions has very little to do with us. You may recall when it first came out, we were on 2G, 3G, and those ways of transmitting the signal to the from the tower to the cell phone was a way that made it very difficult. To try to find a solution for hearing aid compatibility was very difficult. Now that we're on 4G and moving toward 5G, it's just much easier. So it is the cell phone industry has been working with us for years. And now we've gotten to the point where we made an agreement in 2016 that 85% of the phones that are produced must be tested and hearing aid compatible. So beginning this month, I guess that's tomorrow, 85% of their offerings from each of the companies must be hearing aid compatible. And what we're hearing is that not only have they reached 85%, they think they're going beyond it, not by much, by like 85%, 87%, maybe 90%. But still, that's much, much better than we had years ago. Still, it's not 100%. So we are now, we agreed in 2016 to creating a task force. And I'm working on this task force along with NAD and TDI, National Association of Deaf, and Telecommunications for the Deaf and Hard of Hearing, as well as we have our technical advisor, Linda Cousins-Spitek, who has worked for Gallaudet for many years and just recently retired, and will come and consult with us to work on hearing aid compatibility issues, among other issues. So our report is due next year. We're starting working on it now. We've collected a lot of data. We've had surveys. We have to digest all the material we have, and then we'll provide a report to the FCC, heading toward 100%. Industry is never going to want to see 100% on the books, because if they write it on the books that they must be 100% hack, that means there's no flexibility. There's no, they could be fined for not coming up to 100%. So we will see where we go with negotiating with them. I want to get as close to 100% as possible, but we may have to give maybe 97%. We'll see what we can negotiate. So there's a little bit of room. We're actually not interested in seeing anybody fined by the FCC or anybody else. What we're interested in is compliance. We want to make sure that there's motivation and a reason for them to come up to speed, to bring as many phones as possible into compliance, so that we don't have to hunt forever for a phone. We know that when we go in the store, if we knew every single phone available in the store was hearing aid compatible, it'd be much easier to select a phone. As it is, we have to hunt to find the phone. Even with the 15% only, it's still that 15%. If it's in a phone that you saw advertised that you wanted, that's a problem. So we're working on it, and we'll have a report out next year. Okay. Here are some other rules you should be aware of. Carrier websites. Now, the carriers, the AT&T, T-Mobile, Verizon, those websites are supposed to show you everything that you need to know to find a handset, a hearing aid compatible handset. And we negotiated with the FCC, so the rules are in place. So you need to know what models are offered, what are their ratings, an explanation of the rating system, how does the handset function? Is it a flip phone? Is it a smartphone? And a list not only of hearing aid compatible phones, but the non-hearing aid compatible handsets as well. So if you don't find the information that you see that you need on the website, tell the FCC. They are supposed to comply. The labelings are going to change though. The manufacturers and service providers must clearly show hearing aid compatibility. Right now, we are on a regime that talks about M&T ratings. So that meant the microphone in your hearing, if there's interference with the microphone, or whether or not it connects with your telecoil. So those M ratings, you would see a 3 or 4, and it meant if it was 3, it should be okay. If it was 4, it should be a good connection to your hearing aid. However, that's changing, and they're moving into a new regime where it's either pass or fail. And that's okay with us because what they did was make the testing harder. So in order to pass, it really had to be a good connection to your hearing aid. And if it failed, then they don't have to write anything at all about whether or not it's hearing aid compatible. So if it shows nothing, chances are it's not compatible, or it's new and hasn't been tested yet. So my advice always is to test a phone to see if it works with your hearing aid if you bring it to your ear, to see if there's any interference, or if you use a telecoil to make sure it works with that telecoil. And in-store testing is still part of the regulations. Now, I haven't been to a store in a long time, certainly a whole last year. But before then, some of the stores were real iffy about having models on the floor that were live, that is, that you could test. So we have not pushed this issue because of COVID, but once we get to a point where people are regularly going back to the stores, we want to make sure that people can test their hearing aid in the store. The volume control is a new issue for mobile phones. It's always been, landlines have always been there, but we've now got technical standards for that to make sure that you can get the volume you need. And they're set up in such a way that they're all the same, that you can compare apples to apples. But we also added a volume control requirement for wireless handsets so that you could have amplification that hopefully would help you when you're listening with your hearing aid. So look for that too if you buy a new handset. Okay, so moving on to IPCTs. This is Internet Protocol Caption Service Phones. So that's what you typically have as a caption phone. There are 2 kinds of caption phones, but very few people have the first one, which is the old analog caption phone. That used to be the one you could get. That used to be the only one you could get. It was the first one that Captel came out with. And Captel's now the only one that sells these things. And they mean that you don't need an internet connection, but you could only receive calls coming. Now I'm forgetting. It's either you could only receive coming in or going out. I'm not sure which way it was. I think it was going out you could do, and coming in you couldn't do. So whatever, you needed 2 phone lines to make both happen. So Internet protocols solve that problem. If you need an analog phone and you need me to find out which way it is, I'll find out for you. But it's been so long that I dealt with caption phones that I don't remember which way it was, but it was only one way you could use it. So state programs still have them, and you can still get an analog Captel phone from Captel. But right now, most of the phones are IP, Internet Protocol phones. So we have been working with the FCC on rules about this. One of the rules in 2018 is we separated out the captions from amplification. Used to be if you picked up an IPCTs, if you picked up a caption phone, and you had to increase the amplification every time you did it, because there was a rule that it had to go back to 0 for people who are hearing. So if you have 2 people in your house and one person is fully hearing, the other person has hearing loss, they didn't want to blow away the person's hearing, but they linked it to the caption. So now that's separate so that you can set it to whatever level you want when you pick it up. They also were really worried about caption phones going out to just anyone. So they want the providers to make sure they get information and education about how the system works through the telecommunications relay fund. It's not free. You don't have to pay for it, but there's a fund that pays for the minutes, the times that you're using on the phone. So people wanted to let people know it wasn't not just a freebie for every, where did it come from? Who knew? We wanted to make sure that people understood that it costs something to the telecommunications fund people, which are how it works is that every telecom provider that provides a phone line contributes to the fund, and that pool of money goes to pay for the services that we receive. And that's under the Americans with Disabilities Act. And then make sure that nobody who does not need a caption phone uses it. So that's part of the issue. The other thing that you should know is that you can complain. If you have problems with your caption phone, you can go to the FCC and file a complaint. If you have a state phone, if you've got a phone through your state, you can complain to the state, but you can also complain to the FCC, which has oversight on the state programs. So also in 2018, a new thing happened. So there's an old method of how captions were provided and a newer method. And the newer method allows for completely automatic speech transmission, speech recognition systems to provide the captions on phones. And those happen on apps. So you have a smartphone, you download an app that's a relay app, and then you no longer get a human being in between you and the other person. The human being was there to translate, to allow their speech recognition system to understand the voice, because accents were real good in the beginning of ASR, but also to correct any mistakes. So the newer ones say, oh, well, speech recognition is so good now, we don't need somebody in between. Well, we'll see, but there are a few providers now that are only providing ASR captions, and you can download those apps. There are a few that does mixed, so they provide caller assistance in some, and then some fully ASR. And then there's InnoCaption provides CART captions, but also you can switch over to those ASR, those automatic speech recognition captions if you choose. So they're allowable under, and we have more providers as a result. So the competition is good. But again, the jury is out on whether this is good for us or not. And if you have an opinion, even an opinion, you don't have to complain. You can send that also to the FCC, who is closely watching this. Now I'm going to talk a little bit about state laws, just so you know what's going on in the rest of the states in terms of their local laws. So these are the kinds of laws that are going on out in the country that relate to hearing loss that I have heard about. It's possible there's some other stuff going on that have not been brought to me, but these are the ones we know about. So some states have a telecoil counseling law. Some states have telecoil training laws, which means the audiologist must tell the consumer how to use a telecoil. Hearing loop requirements. Now, Maryland just got one a couple of years ago. Minnesota, Indiana, or other states that have that. Hearing aid trial period, refund rules, New Mexico. They list only New Mexico here, but this came from one of our website, from one of our members, Steve Fraser, out in New Mexico. But we know that about 20 of the states have some rules about return period, the trial period, and how to refund. Some states have no rules at all, in which case, if there's no rules, it's just a contract between you and the provider, and you can just negotiate. I want, if the provider says, no, we don't have a rule, then you can say, well, I won't buy my hearing aid there. So you can talk to them. But if there's a state law, then that means they must provide at least a minimum of, usually it's about 30 days. They can always provide more, but they must provide minimum under state rules. So other states have hearing aid insurance coverage. So all those states that I listed have coverage, but only 3 of them, the ones that are highlighted, include adults. We have been told that when legislators listen to people coming to them and wanting insurance coverage for hearing aids, they say, let's go for the kids first, and then you can come back to us later for the adults. And that never happens. Even these states, Rhode Island, Connecticut, New Hampshire came up front and said, we want adults too. Children, yes, definitely, but adults too. So we encourage people, if they want to go back to the legislators, feel free to do that. Changing laws, especially insurance laws, are difficult. It's not a slam dunk. It's not usually just one session of the legislature. It takes a while. It takes some commitment and time on the part of the people in the states. A new one is open caption movie requirements. Now, the only one we've heard recently that's really working as a state on this is Colorado. Hawaii already has a law in place. Because Hawaii did it and basically flew under the radar, the movie industry was really surprised and not happy. They are now very interested and very much watching what's going on. And so in some places, they will voluntarily provide open captioned movies on their own. You know that Eric Nordloff in the DC area has been working on it to make sure that there are more open captioned movies. So that's another way to do it, have consumers negotiate with providers, with theater owners, to provide those open captioned movies. And I think it's not going to be an easy thing to get a law in place because, as I say, the industry is very much against it. And now with the pandemic, a lot of these places have been hurt and they're not eager to have requirements. So, and they're probably going to find legislators sympathetic to that right now. But that doesn't mean you can't work on it. And I'm working with the folks in Colorado to see what they can do about moving forward on that. And then some of the states also require some, now when I say public television, I don't mean like PBS. What I meant is television that is seen in a public place. So if you have a sports bar, there are now in some states requirements. Now under the ADAs, they should turn it on and request, should just happen, but it doesn't. So states and cities have taken on some of the consumers have gone to the states and said, we need this as a law. And some of the cities and some states, Washington State and New York, requires captions when the televisions are on. Now I have New York with an asterisk there because I saw this again on a website, but I'm not 100% sure that they're on board because another one had conflicting information, but they might. Maryland recently, or actually a few years ago, put a law together that said you must provide captions when requested. So it's not quite the same thing. Washington State says you just have to have it on all the time. Maryland found that the business community was not happy with that idea. So we compromised and had on request. Okay, so I also promised to talk a little bit about what's happening with the pandemic. And I want to say that when the first pandemic came out last March, we really hustled and we had a lot of people contact us by email saying, what do we do? We're worried about masking. We're worried about going to the ER, not being able to hear. We're worried about communication in general. A lot of people contacted us. Since then, and we built a whole page on our website that has COVID-19 information related to communication access. So, but I was just recently talking to our webmaster who said, we have a lot fewer hits on that page. There are not as many people who want to have the information. And I can tell you, I'm getting a lot fewer queries about it, a lot fewer people who are worried about it. People have reached some kind of equilibrium. They understand how to communicate, such as it is. That said, the new normal does not make it easier for accommodations. So it's been very difficult for people with hearing loss in terms of ensuring that if they're out in the public or if they're on Zoom or another video platform, getting the accommodations you need is not always a slam dunk. Sometimes it is worked out. Sometimes people can work it out, but not always. So we're not convinced that this means everything's well. For example, my pet peeve is CVS. Before the pandemic, and this was years ago, a group in New York City said, CVS, you don't provide accommodations. You are in violation of the ADA. And CVS said, I'm sorry, that's not true. Whenever somebody asks us for an accommodation, we work with them, but nobody has come to our store asking for accommodation for hearing loss. Well, certainly they didn't seem to have gotten written requests or lawsuits. Now it really is hard. Back then, there are ways to communicate. It's a very brief conversation. You don't have to spend a lot of time talking to the people behind the counters, whether it's the pharmacy or the upfront guys. But it's much, much more difficult. So it's a pet peeve of mine, and I don't know if it's others, that CVS and places like them should be providing accommodations, particularly because everybody in those stores have been masking and will continue, I think, for a while. There are people interested in that, let me know. The other thing we've been working on is video platforms. So we know that Zoom, like you're using today, does provide free automatic speech recognition captions to paid accounts. And they will give it to free accounts if you request it. They also allow you to integrate, like today we're using CART. They allow for you, by integrating, I mean, you can see the CART in the same way you would see the ASR captions. You don't have to have a separate window. You don't have to bring in another URL. They're all part of the feature. So in some ways, Zoom has done well. And I have to admit, I like the feature that you can move the captions wherever you want to. That's really a nice feature. But not everybody does the same. So Google Meet and Microsoft Teams provide free ASR captions. And the good thing they can do is that they're controlled by the user. So when you set up a Teams meeting, the user, the person who needs it, can just click on the captions. With Zoom, for people who got here early, you might have noticed that we were saying, well, have we set it up? Who is the host? Who gets to turn on the captions? So it's always a question. And for a meeting like this, we're patient, we're fine. But if you were having an interview with a new employer and you were trying to explain to them how to turn on the captions, and you wanted to tell them to go out of the meeting and back in, that's a problem. So it was, in fact, one of your own members who brought this issue to me. And I'm having a senior moment, I'm forgetting his name, but it was really helpful because now I talk to everybody about having user control, and we may get there. We're pushing on that. Now, the other thing GoToMeeting does, and Microsoft Teams, they will not allow you to integrate CART. So you can have it as a separate window, but it's not part of the whole thing. And the same thing with GoTo, they don't allow either. They don't have CART or ASR captions. We have on our website, we have a list and what we're called a matrix that was developed in 2020 that talks about the different features of the different kinds of platforms. Now, because it was May of 2020, and maybe some of it may be outdated, so you should always check, but it's a useful tool. It helps you see what's available out there if you need to look at video platforms that you can talk to people, or if you're going to be using it for business or family or meetings, and you want to be sure you can get access. And then the final thing about the pandemic that I'm going to speak to at the moment is telemedicine. Now, we know that doctors' offices and hospitals are places of public accommodations under the ADA, the Americans with Disabilities Act. And And we know that telemedicine took off during the pandemic. My own practitioner, my own primary care doctor started using telemedicine with never before used. We also know there's some HIPAA compliant video platforms that provide captions. So it's a possibility to do it, but we also know that it's rarely used. And part of that, we believe, is it's just plain ignorance. Doctors don't know tech to start with. Somebody sells them something, they're just happy to have it done. We have to have the responsibility, unfortunately, as consumers, to tell them, you can't just have a platform, you have to provide captions too, or I can't understand what you're saying. So it's an education process, we think. It's possible at some point somebody will file a complaint if it happens, if it becomes the only way to access doctors. We'll have to see. So far, I've not heard anything filed with the Department of Justice, or any settlements come up. That doesn't mean it doesn't happen. We have a big country, but I haven't heard anything about it. So, but it wouldn't surprise me at some point somebody sued their doctor or their hospital, more likely. I will say that the FCC's Disability Advisory Committee is looking into provisions to allow you to bring in Relay so that they could integrate Relay. We had this question early on before Zoom had their integrated captions, free captions of what can I use? I have access to one of the caption providers. Could I just share my screen with everyone so they could see the captions I'm looking at? And the question I took to the FCC was, wait a minute, what happens if some of the people out there are fully hearing and not entitled to see Relay captions? On the one hand, they have strict rules about people who don't need it, not using Relay captions, using caption phones or Relay captions at all. On the other hand, if one person does it, that's much better than 6 or 20 people calling into different Relay providers. It's a much better use of their time. I think they're going to, from what I'm hearing, they're going to come down on the side of let's find a way to integrate Relay captions in, and let's not worry about the fact of whoever's viewing it. If we have at least one person viewing it, it's a legitimate use of captions, Relay, caption Relay phone services, and caption apps. So I think that's what's going to happen, but we don't have a final word on that yet. Fortunately, we have some free caption services in the meantime. So that's all of my slides. This is how you can contact me, and I'm willing to share my slides at any point. I'm going to stop sharing now. And how, Russ, how do you want to do this? Do you guys want to read the questions to me, or should I look through the cart? Not the cart, the chat box.
I don't think you can hear me, and I can't. Oh, you can hear me. Good. As I was about to say, I wasn't sure that I would be going to be able to unmute myself. We can either go through the chat box, but although I have to say, I personally can't see it. Why, I don't know. Or we could have people just raise, go through a hand raising process. If you can see at the bottom of the participants.
This is Lisa. Why don't we just have people raise their hands, because I don't see anything right now in the chat box, unless I'm missing something. So I see Wendy has raised her hand. So go ahead, Wendy.
Thank you. I have, thank you so much. This was really interesting and helpful. It was great. I have 3 questions. One is the hearing instrument specialist that you mentioned with respect to what you're trying to get covered in the legislation. Would that be like the Costco employee who helps you with a hearing aid? Or who are, I know I have an audiologist, but I don't know what a hearing instrument specialist is.
Okay, so a hearing instrument specialist is, yes, like the people I mentioned at Costco. These are people who are allowed by state law to provide, to sell a hearing aid. They do not have the same level of education as an audiologist. Audiologists now have an AUD, which is essentially a doctorate degree. A hearing instrument specialist is somebody who could basically be trained on the job. So they're not nearly as, they don't have the educational background. However, I have met some hearing instrument specialists, we used to call them dispensers, who are excellent, who knew what they were doing, who'd been in the field for a long time and understood how to fit a hearing aid with the person who needed it. I think across the board, no matter whether you're an audiologist or an instrument specialist, that there's some bad ones, just like any other practice. There are going to be some great people and some wonderful, wonderful dispensers and wonderful, wonderful audiologists and some not so hot. So it's always incumbent upon the consumer to make sure that they get the kind of services from whoever they go to that they feel are right for them, that they have a good communication with them, the person is answering the questions, the person's not just selling them a hearing aid, but understanding that hearing loss has to do with their whole life and how they communicate with everyone else. So that's really our stand. I'm sorry, go ahead, Wendy.
It sounds like it's the difference maybe between an optometrist and optician. Is that right? I mean, the optician makes the glasses for you. The optometrist has more experience training. But actually, opticians are licensed in some states and not others, or certified in some states. And it sounds like the hearing instrument specialists wouldn't be certified anywhere. Is that right?
So right now, in terms of certification, usually the state certifies license. The certification can come from the accreditation body. So it comes from ASHA or AAA for audiologists, and Hearing Instrument Society, I believe that's the name, for the specialists. But the licensing comes from the state. They have to pass whatever testing they have and pay whatever fees they have to pay to get licensed to dispense in that state. So that's different also. It's kind of sort of like what you're saying, optometrists and ophthalmologists. These are audiologists are not medical doctors.
No, I was saying the difference between an optometrist and an optician.
Optician, right, okay.
Yeah, because neither of them is medical, but one still has more training and breadth in what they can look at and assess. The other is much more specialist just for the device, in glasses or contact lenses. So it seems similar. But I also, I wanted to, two things. I don't want to take up too much time, but one is I want to encourage you to go ahead, keep going with the masks and accommodations because of the pandemic, because I'm somebody who medically cannot be vaccinated at this point. And it's horrifying to me. I'm really scared about ending up in the emergency room where I can't communicate because people are wearing masks and I'm not in good shape. And so I've actually talked to my doctor about that. I'm trying to, I don't go out at all. I mean, if I get COVID, it will be because somebody brings it into my home doing maintenance or something like that. But I don't, right now I'm not going out because it's too dangerous. So I'm not somebody who is a denier or an anti-vax. I'm somebody who medically cannot have the vaccine. So I'm still vulnerable. And the mask issue is very live for me. The problem, well, the good thing, I guess, for many people is that many people won't be as concerned because they'll be fully vaccinated, and once the D variant tamps down, maybe it'll be safer for a lot of people, but there are still people who can't be vaccinated, and it's going to be a live issue for us in emergency situations. So that's one.
So let me just pause for a moment there. So if people cannot take their masks off and you still need to communicate with them, whether it's an ER or a doctor's office or somebody coming into your home to do repair, There are options if they work for you. Assisted listening devices can work very well with masks if you can bring the microphone close enough to somebody's voicing that it can pick up the sound. If it's far away, it has the same kind of problem, but if you can hand somebody a mic and then clean it later, although we find mostly it's the through the air transmission that's the problem, but yet that is one solution if you can benefit from assisted listening device. The other products are speech recognition apps. There are free ASR apps you can download to your cell phone. You can also, it works better if you get an external mic on that as well, but it has worked in situations for me where I'll just hold the phone and it will pick up what somebody else is saying. You can use Live Transcribe, Otter AI, Ava. There's a number of speech recognition apps that are well. And of course, you can rely on things like Whiteboard, even though that's really primitive and not as good as picking up the speed at which people are speaking. You can, there are some workarounds. They're not great, and I'm sorry you can't get vaccinated, because I think people have been getting more vaccinated, and that's been a help. But those are some possible ways you can work around the masks.
Thank you, because I don't have a good app. I've been disappointed actually with Zoom's captioning quality, and I have an Apple phone, so I'm not, as long as I'm home, I'm not really dependent on captions. I use headphones and it's fine because there's not a lot of background noise, but it's when I go out. And right now, also, I haven't been able to get hearing aids. My audiologist was afraid that I would have reactions, like sensitivity reactions to the hearing aids. So for now, I'm sort of in between solutions, and that's why. But it sounds like you're saying that some of the voice recognition or some of the speech recognition software is a lot better, or the apps are a lot better than what's on Apple or what's on Zoom. Is that right? They're not all like those speech recognition. Some of them are better.
Right, not all speech recognition apps are the same. You should try out and see what works for you. I found, for example, that if I am talking to somebody with a deaf accent, that Zoom does very poorly, but Google Meet or Teams seems to do better. So that'll be the same with the different downloadable apps that you'll find. So you should work with the people who you most frequently speak to and see which of the apps works better.
Okay, thank you. I'm sorry, I have one other question, but I don't want to take up everybody's time. And that is when there's a DC, when the DC regulatory office starts, will they, I guess I'm interested in more of what they'll do. Will they help spearhead advocacy for us to have state law like some other states have, or will it be entirely problem solving for individuals?
I'm going to defer to Judy on that. Judy, go ahead.
Sure. Thanks for that question. The DC Office of Deaf, Blind, and Hard of Hearing is, if you go to our website, HLAA-DC.org/blog, you will see the chronology of iterations of this bill. As it stands now, the primary purpose is to simply ensure, which the Office of Disability Rights was not doing, ensure that the hard of hearing and the deaf community are provided with appropriate accommodations. If I go to a neighborhood advisory committee meeting and I can't hear, I should be able to request an accommodation and it should be provided. I shouldn't get this yada yada stuff. Similarly with various DC government agencies. 2 months ago, the chair of the DC Council, Chair Mendelson, had an all-day open hearing. You have to schedule yourself. There's going to be like 200 people to talk about why you were supporting whatever you were supporting. It did not provide hearing accessibility. Afterwards, I had a long talk with his chief aide, and we discussed that they really needed to do this and how they could do it. And they were not aware that Zoom offered ASR. I mean, I'm not saying you should have a captionist available for 12 hours during the length of this hearing, but there are accommodations. So that's what the office should do. And by the way, Wendy, 38 states have such an office. Part of the pitch with DC, if DC wants statehood, they better step up and start acting like a state. I hope that answers your question.
Yes, thank you.
Thank you. And I have to congratulate Judy and all who worked on that, because it's not an easy process to get a new office in place. And not only that, got it funded. So congratulations on that. Bruce has his hand up.
Yep, I've got a couple comments. And anyway, first of all, you mentioned CVS, Wegmans, and their 101 stores should have a telecoils at the pharmacy service desk and at least one checkout stand. And the HLA here in Rochester has been working with them to test some new equipment, so it makes it easier for them to install the loops in different areas. The original loop they used took an awful lot of work for them to install, and they're coming up with something that can be just like, you know, put down on the counter and it'll work. So they're working on it, but Wegman's doing pretty good at that. My two hot items. First of all, in New York State, we do have the the captions on public facing TVs law. It came to effect, I think, on July 1st. Of last year. The problem is COVID got in the way and nobody knows about the law. So you still go into restaurants, you go into sports bars, nobody's got the captioning on. I go over to the manager, say, hey, did you know there's a new law? I didn't know about it. We have to figure out some way to let people know that law exists. They're willing to turn on the captions if they knew the law was in existence, but they don't know the law exists. And then the third thing is my hot item, and Lisa knows, is closed captioning on TV commercials and newscasts. Here in Rochester and Syracuse, two of the stations have cart captioners. One of them uses the teleprompter. The teleprompter one, you come to the weather and you get two lines of weather that come on, flash on, and they flash off because it's the teleprompter only has, the guy only has two lines that they some guy typed in for him. Newscast or live broadcast from a remote or something like a fire or something. They're never captioned on the teleprompter guys because they don't have the script. The live guys, of course, are captioned. And then TV commercials, what burns me, first of all, I'm convinced that car dealers and lawyers don't want to sell to us. I mean, it's just never captioned. But what really burns me is there's a couple of hearing aid companies who don't open or close caption their ads. And I'm wondering who they're selling to, because you can't, you watch their ad without sound. You have no idea what they're talking about, except for the name of the company. Maybe that's the point, but I mean, they should know better. But I think the FCC needs to revisit the program rule as to, you know, things under 15 minutes or under 5 minutes don't have to be captioned. I think they need to change that to everything needs to be live captioned. Just let it be, you know, the way it is. But it just burns me that all these advertisements and some of the national ads for national items like cars and soap and stuff, not captioned. It really bugs me.
So the good news is that the FCC just recently put out a request for information about, actually it's more like a public notice that said that they're going to be looking at these issues for CVAA, which is the Communications and Video Accessibility Act of 2010. And we put in 80 pages worth of comments on that. One of the sections on that was to do with, you know, hey guys, it's time to look at your captioning rules again. Captioning rules were put in many years ago, things like ads, things like there's no captions required between 2 a.m. and 4 a.m. Except for the fact, no, 2 a.m. and 6 a.m. Except for the fact that people now have news programs on at 4 a.m. So it's time for them to look at these rules again. And I think the FCC is receptive to doing that. along with some of the other things in our 80 pages that we asked them to look at as well. So the ads is certainly going to be looked at. What you're looking at is the ENR, electronic newsroom technique that's used, or newsroom captioning that's used now in some places. We are going to take a hard look at that too. And anyone, again, I would encourage you to complain. Go to the FCC if you see something, even if, you know, you don't. And I would also suggest, this is what I've also heard, is that sometimes people complain and then they say, well, you know, my news station is using ANR and I only saw 2 lines of the weather and that's not adequate. And then the news station says, oh, no, we're not to blame. It's somebody else's fault. Now, the FCC can only take in what's given to them. So my suggestion to everyone is to be persistent. If you don't like the answer, go, FCC, this does not make sense to me. Take another look. Because even if it sounds final, it may not be final. So keep going back to them and saying, this is still happening. It's still a problem. Whose fault? If it's not the station that's broadcasting, whose problem is it? Find out, because it could be somewhere along the line that there's a problem. To me, that sounds like really a newsroom technique that's a problem, but you never know. So always go back, because they are taking these complaints seriously and they always tell us they do not get enough complaints. So please do. Bruce, did you have another? Your hand is still up. Did you want to?
Oh, I'm sorry. Yeah. No, I'm all set, but yeah, thanks for the answer. There's a chief engineer here in Syracuse where I'm at the moment, who we're almost on first name basis. I complained to him so much. I think he's getting tired of me. But you know, they use the ENT and I said, well, you got a sister station, same company owns them in Rochester, and the weather report, the guy typed in the whole, almost his whole script before he does the weather, and we get pretty good captioning for him. Same chain here in Syracuse, 2 lines, and they flash on us off so fast you can't see them. And I keep complaining. We're gonna win eventually. So, but thanks very much.
Okay, great. Thank you, Bruce. Lisa, did you have a question? Or Judy, you're raising your hand. Are you telling me time's up?
Yeah, I just wanted to share in terms of doctors. I went for my wellness exam about a week ago, and my doctor was masked. She speaks very clearly, and it was pretty okay for me. I had to go back 5 days later, and my doctor was on vacation. So I saw another doctor, and I have complained constantly that they don't keep track of who has a severe hearing loss. Mine is moderately severe. So the other doctor, who's the doctor to my cousins, comes in and she had a clear mask on. And so I was able to also lip read her, and it made a huge difference. And then she had to go out to do something. And when she came back, she had a black mask on and she started talking. And I said, I'm having trouble hearing you, making out what you're saying. Could you repeat? And she went, oh, and she walked out and came back in with a clear mask. So I say that because doctors can get clear masks. And I think we have to start advocating. My own assigned doctor, it's a concierge practice. I'm going to send her an email because I know she comes back to say, I hope the next time I see you, you will have one like your colleague does. And I also would say, as far as captioning goes, people have not discovered that Zoom has free ASR captioning. And I recently attended 2 events that were not captioned, and I immediately contacted them about them. And one was a Nassau County, New York public library. And they said they were not aware that Zoom had captions. So I just can't urge everyone enough. I mean, HLAA does such a fabulous job. I have learned a great deal by attending Montgomery County and DC meetings. And one thing I see is we have to be our own advocates. Lise, just the way you work so hard on all these legislative and regulatory things, we each have to do our own part with the people we encounter.
Thank you, Lisa. That was nice to hear that. Judy, you had your hand up before.
Yeah, I would just, before I get onto my question, really underscore, Lisa, what you had to say. Every encounter I have, I find, is an opportunity to advocate and educate. My medical doctors, going to the store, what's the most recent? Oh, I tried to order fast food. And they have the keyboard has certain questions I have to ask, mask, screen. I didn't have a clue. So I said, well, let me just tell you my order. They couldn't do that, right? The kid behind the counter, they have to go through this series of questions. So paper and pencil sometimes is not bad, but I do find that people are intrigued with voice to text apps, or I have an Android I use solely for the purpose of using voice to text. So I agree with you. I mean, it's like the council chair's office. I could have been irate. I could have had a lot of reactions, which I did, but I didn't share them with the council's office. But the opportunity to educate them and the commitment that they in turn would educate the other council members about the availability of Zoom-free ASR. That's it's a painful win, but it's a small win, I think. I would agree with you, Lisa. My question is, not to get ahead of things, but there's all these advertisements, and I saw that HLAA actually ran a nice piece about how it's done more harm than good, that the FDA has been slow in regulating some of these things. I get questions all the time from people who say, what should I do about the direct-to-consumer over-the-counter? I see this ad, I see that ad. That's really multiplied in my personal experience. The FDA does not regulate those yet. And yes, they're supposed to have a 60, 90-day whatever return policy. What's your best advice to tell these people, besides, of course, see an audiologist, get a good baseline, start right? But a lot of these people I talk with just want to know, what's my recourse? Is there any in the Wild West these days?
So there is recourse, even in the Wild West here. Right now, who has oversight on all of this is the Federal Trade Commission, the FTC, not the FDA, but the FTC. So you could take complaints there. You might even be able to take complaints sometimes for a state, then go to the state attorney general. Does DC have a state attorney general? Somebody take it to, okay, you guys know this better than me. I don't know what happens in DC. God forbid you have to take it to Congress. So if you can take it there, you can go either locally or you can go to the Federal Trade Commission. Now, I will say this about the Federal Trade Commission. They are also understaffed and overworked, and they don't do things quickly. But if they get enough complaints, I mean, they were working with us before the OTC law, and they were very much on board and part of the meetings that happened that made the OTC law happen. So they're aware of this issue, but they're not proactively going out and suing people. So if you send a complaint there, they may respond, they may not, but that's where you would go.
Thank you.
Yeah. Wendy, did you have another question?
I do. With respect to telemedicine, I wonder whether you know, because I've been staying in, I've been using it quite a bit. But I looked through the Medicare 2022 brochure, and it looked to me as though Medicare is discontinuing reimbursement for telemedicine unless it's in a rural area for 2022. Do you know whether that's true?
I don't have information on that. What it sounds like is that during the pandemic, CMS sort of put their roles aside for the moment to allow people to get access. So telemedicine is one of these things where it's crosses states. That's where it gets a little tricky because most practitioners are licensed by state, even a doctor, a hospital, they're licensed in the state, not outside. And the question of can they do out-of-state work becomes an issue. So who has been really working hard on this is the Veterans Administration, where they would like to get people to get services that are not just in state. They don't, because of course that's a problem for vets. So we will see. I don't know the answer. I don't know if this is permanent or if it's coming back in place. I have not heard, but it's certainly something we'll watch and see what goes on with that in terms of telemedicine. Certainly in-state would be, if you have your own practitioner, there should not be a problem using that. But I'm not an expert on that, so I would have to dig into it a little bit to find out. Judy, you have your hand up?
The issue is whether whether Medicare will reimburse for it, because I know like the American Psychological Association has been trying for years to adjust to the potential of telemedicine with licensing. But I know that the federal government have been talking about whether or not to extend telemedicine, and it looks like they may have decided not to. I guess that's what I'm wondering about.
That sounds like it's, I'll take your word for it kind of thing, but I would be surprised if that didn't change because everybody's moving in that direction, but we'll have to see. Now, Judy, you had your hand up. Is it related to this? Because Russ had his hand up before, so.
Yes, it is. Just quickly. Thank you. I'll be quick, Russ. Wendy, I just had experience with my primary care, who is based in DC, and I've done telemed during COVID. And it's time for an annual physical, which I did a couple of years in person. So we were chatting and I said, I really like telemed. I said, I'm assuming you, doctor, get paid the same amount for telemed as you do for an in-person visit. And the answer was yes, during, as you said, Lise, during the COVID period, but that's going to rescind. And so the compensation to the doc is going to change. Telemed, less remuneration.
Thank you.
Go ahead, Russ.
You're muted.
Okay, thank you. No, I think I just unmuted myself. I'm sorry. I may be asking a question, that has already been answered, but my system conked out for 5 or 10 minutes, so I missed few things. First of all, one short announcement. Lisa, you mentioned dementia and hearing loss. And I just wanted to remind people that basically is our next topic. That will be a program on the 31st of October. Happy Halloween. And those of you who are on our mailing list, the announcements will go out quite shortly. And again, reminding people that if you're not on our mailing list and would like to be, just send a message to HLAA-DC chapter, HLAA-DC CHAPTER @gmail.com. And we'd be happy to put you on that list. Couple of questions, Lisa, if I might. We're getting back to the subject of Medicare and possible coverage of Medicare. I know that, under reconciliation bills, they're extending Medicare coverage to include, among other things, hearing aids, is on the docket. But from everything that I can read, the price tag is going to have to go down. I mean, I think Congress is not about to pass a $3.5 trillion package. And my guess is, correct me if I'm wrong, that this is likely to be vulnerable. That's one question. I'll ask another one while I'm here as well. Over-the-counter hearing aids, for mild to moderate hearing loss. One problem actually sort of came up, at our last session. Tom Powers repeated basically a presentation that he had given at the convention. One thing that strikes me, as interesting and not promising in this respect, they did one sort of study in which they took people, who acknowledged that they had a hearing problem on the one hand, and people who did not on the other hand. And what they found out was that people who acknowledged they had a hearing loss generally substantially underestimated the severity of their hearing loss. So what that seems to imply, what I sort of get is, are you likely to run into a problem where people think they've got a mild hearing loss and actually it's pretty severe, or moderate hearing loss, and actually it's more than moderate, it's moderately severe to severe to profound, and likely be underserved then with over-the-counter hearing aids if and when they, well, I guess it's not if, it is when they become available.
So I'll start with your second question first. I believe it's probably true that people underestimate the amount of hearing loss they have. However, even if there were no over-the-counter, if this law never happened, some people will not be served because they will not purchase a hearing aid that costs more than they can afford. So to me, at least it provides a possibility of addressing your hearing loss. One of our members of our board is Dr. Carrie Neiman, and some of you may be familiar with her work.
Yes.
She used a pocket talker, for goodness sakes.
Yeah.
She used a PSAP, and these people got substantial benefit because they did something about their hearing loss.
Right.
The other thing that happens is sometimes people will buy a $2,000, $4,000 hearing aid and ends up in the drawer. To me, that's a much worse thing than having a $300 item that ends up in the drawer. So while the hearing industries, and Tom Powers works with Hearing Industries Association, he's very well respected, I'm not taking anything away, they have a different perspective than the consumer. I want to see every consumer get a hearing aid who can. The second thing is that we cannot also forget, this is not just for the first-time user. This is not for the person who's never had a hearing aid before. People who've had hearing aids, who know their hearing loss, who've been stable for years, may say, you know what? I don't want to spend $4,000 on my next hearing aid. I want to spend $300 and see if that works for me. Or maybe I want to use a $300 hearing aid or over-the-counter device when I'm running and I'm sweating, and I'd much rather not, ruin my very expensive premium hearing aid. So there are multiple ways and multiple reasons for people to get it. And I am still, my biggest problem is with education. I want people educated, and that I agree with. And people need to know what's the possibilities and what's out there. But I strongly feel that over-the-counter is a way to shake up the market. Remember, years ago, there were only 6 providers and you got what they had. And you could only go to an audiologist or a hearing instrument specialist. This is now opening up the market, and people have to educate themselves. They have to take responsibility. But I think it's got possibilities when a company like Bose, which is a consumer product who knows how to sell products, and their products are good products, audio products. When they get in the market, it shakes things up and creates competition where before there was none. So that's over the counter. So let me talk a little bit about Medicare and your question. And you're gonna have to remind me your question.
It's just basically, what's your notion of what is your prognosis? Is this going to happen? And is this going to happen in my lifetime and yours?
Okay, so we know, yes, we have members of Congress who say, this package is too big. Well, remember, there's the infrastructure package and there's the reconciliation package. So who knows? Here's my thought about it. I still am very hopeful. I think there's some real chance here because we've been talking about it. Everybody's talking. It's not like some little thing that nobody talks about. There's lots of things in these packages that you have never heard of. But this one is talked about. Bernie Sanders is talking about it. Elizabeth Warren is talking about it. There are people, and the president is aware of it. So it's a much higher level. And it was part of the HR 3 All of these things makes me feel very positive about it. Am I certain it's going to happen? No way. I would not bet the farm on anything ending up in here. We know something's going to get lost. But I feel like it's for the first time in my professional life that there is some possibility it will happen.
Thank you.
Lisa?
Yeah, I just wanted to add 2 comments to what you and Russell have just been talking about. First, my first audiologist, and I've only lived in this area now 5.5 years. She often speaks at senior gatherings in senior living facilities and talks to the senior community. And she said that when she started talking about dementia relating to hearing loss, 3 times the number of people approached her when she finished. She said the response was dramatically different. So I am delighted to hear you're going to have a program. Secondly, that same audiologist, I showed her my Bose hearphone, and she said at that time, people really balk at the cost of hearing aids. So if I have a client who has that reaction and I feel they might be a good candidate for the Bose hearphone, she started telling them about it. And I just found out my new audiology practice near the Whole Foods in Bethesda, Rockville, they are now using the Bose over-the-counter and the Whisper product. And my cousin, who is an ASL interpreter, has a deaf brother and a deaf nephew, and who understands hearing loss. They tried it on her, and she said, oh, there was really no difference with my hearing aids. The hearing was the same. And I said, yeah, but your hearing aids cost over $3,000, didn't they? These cost $900 and whatever the price is. And she said, you're right. And I said, had these been your first need with a mild hearing loss, think of that price differential. So for me, if Medicare can get people into the hearing aid world by compensating, particularly for people who are just getting into needing hearing aids, that would be a dramatic help. And I just applaud, again, everything you've been doing to make it happen, Lise.
Thank you for that. And I totally agree with what you've said. And the other piece is that for people who are first-time users, I have talked to audiologists who said, you know what, I'll dispense these over-the-counter products. I don't care. It means they'll be a little more expensive than they were if I just bought them online. But if somebody needs help, I'm willing to use my expertise to help them. And then they have a product that's not, again, as expensive as the premium aids, but that will give them the service they need, and I will help them out with fitting it. So do we have anyone else? I don't see any other hands, so I'm going to turn this back over to you, Russ.
Well, I'm going to turn it over to Judy. But before I do want to thank you. I think it was terrific, as we expected. And thank you very much. I certainly learned a lot. Judy, do we have anything else before we close up?
Thank you again, Lise. Always informative to hear your myriad of activities. Thank you for all you do. Ross, just one thing, and I say it's on behalf of Rachel. Don't forget that on October 16th is the DC Walk for Hearing. If you need more information, Rachel posted the web link, or don't hesitate to contact any board member. It's great fun, great fundraiser, and hope to see everyone there live for the first time in a couple of years. I think that wraps it up.
Good.
Thank you, everyone.
We will
Ross, a comment?
We will make the slides available. Thank you, Lisa. For that. And a transcript and maybe a recording. We'll have to see what the recording looks like. See if that really worked, because we're still experimenting with that. But thank you all.